Hey everyone, and welcome back to the Deep Dive. Today we're going to be tackling a topic that, well, it's one that might be kind of personal for some of you out there. Maybe you've got family members who've dealt with this, or maybe you're just curious about it. But either way, we're diving deep into Alzheimer's disease today.
Yeah, it's a big one and a tough one.
Definitely. And to help us get through all the complexities, we're going to be using an excerpt from this book on neurological disorders. Really interesting stuff. By the time we're done with this deep dive, we're hoping you'll walk away with a much better understanding of Alzheimer's, the causes, how it progresses, what kinds of treatments are out there, the whole nine yards.
That's the goal.
All right, so let's start with the basics. Like, what is Alzheimer's? I always kind of think of it as this thief that sneaks in and steals your memories.
Well, that's a pretty powerful way to put it, and actually pretty accurate.
Yeah.
See, Alzheimer's is the most common form of dementia.
Dementia, right.
And dementia, well, it's kind of an umbrella term, It covers a whole bunch of cognitive disorders that affect, well, lots of things, like memory, thinking, even behavior. And over time, it makes it harder and harder for folks to live on their own, do the things they used to do.
So it's not just like forgetting where you put your keys.
No, it's much more serious than that. With Alzheimer's, things get progressively worse. The symptoms, they don't just stay the same, they actually get worse over time.
And what causes this to happen in the first place?
That's the million-dollar question, right?
Yeah.
Researchers are still working on that. But the current thinking is it's not just one thing. It's like a whole recipe of factors. Genes play a role, of course, but also your environment, your lifestyle, all sorts of things. But one thing scientists have figured out is there are these two telltale signs of Alzheimer's in the brain. They're called amyloid plaques and tau tangles.
Okay, so those names I have heard before, but honestly, I don't really get what they are.
All right, well, imagine this. Amyloid plaques are these kind of like clumps of protein, abnormal proteins that build up between brain cells. They're like roadblocks,
Yeah.
They block those communication pathways in the brain.
Oh, so that's why things get jumbled up.
Exactly. And then you've got tau tangles, which are kind of like twisted fibers of another protein, but these form inside brain cells. Think of them like traffic jams inside the cell itself, messing up the whole transport system.
Wow, so it's like a double whammy of trouble for the brain.
Yeah, it's a lot for the brain to deal with, that's for sure. And over time, even if you've got a healthy brain, these plaques and tangles, they can really start to cause some problems.
Okay, so that makes sense. But then who's most at risk for all of this? Who should be really concerned about Alzheimer's?
Well, the biggest risk factor, honestly, is just getting older. Once you hit 65, your risk goes up quite a bit.
Ah, so it's just part of aging.
Well, sort of. It's more common as you age, but not everyone gets it,
Yeah.
But the chances do double every 5 years after 65, and by 85, it's like 1 in 3 people have it.
Wow, that's a lot.
It is. And it's not just about age, though. Genes definitely play a role, too. There's this gene called APOE4 that's been linked to a higher risk.
So if someone has that gene, does that mean they're like doomed to get Alzheimer's?
No, not at all. Having that gene just means your risk is higher, that's all. It's not a guarantee or anything. Genes aren't destiny, And the good news is there are things you can control that can make a difference.
Okay, so like what kind of things can people do to, keep their brain healthy?
Well, a lot of the things you hear about for overall health are good for your brain, too. Things like keeping your blood pressure under control, managing diabetes if you have it, not smoking, all that good stuff.
Oh, so all those healthy habits we keep hearing about really do matter.
They really do. It's all connected, right? But here's the cool part. The reverse is also true. A good diet, regular exercise, keeping your mind active, those things can actually lower your risk.
So we're not just sitting ducks. We can actually do something about this.
Exactly. You've got some power here. You can make choices that help protect your brain.
Okay, that's good to hear. But let's say someone's starting to notice some changes, maybe in their own memory or thinking. What are the early signs of Alzheimer's, like the things people should really watch out for?
Well, one of the most common things is memory loss. And I'm not talking about just forgetting where you left your keys. It's more like, having trouble remembering recent events or conversations.
So like if you keep asking the same question over and over, even though you just got the answer?
Yeah, that could be a red flag. Another thing is having trouble with tasks that used to be easy, like balancing your checkbook, following a recipe, or even just finding your way around a place you've been to a million times.
So those early signs can be kind of subtle, huh?
Yeah, they can be. And sometimes people brush them off. They think it's just normal aging. But if you notice these kinds of changes, it's always best to, play it safe and talk to your doctor. The earlier you catch it, the better.
Makes sense. Okay, so we've talked about the causes and the early warning signs, but now I think we need to get into the harder part of this, the progression of Alzheimer's. Like, what does that actually look like for someone going through it?
Yeah, that's the tough part. It's a progressive disease, meaning it keeps getting worse over time. So in the early stages, you might just need a little extra help here and there,
Hmm.
like with getting dressed, taking your medication, or keeping track of
It's just
appointments.
needing a bit of support, yeah.
Right. But as it goes on, it becomes more than just needing a reminder. Imagine not recognizing the people you love, or not being able to find the words to say what you're thinking.
Oh, wow, that's heartbreaking.
It is. Eventually, it can get to a point where people need full-time care. They can't live on their own anymore. And in the final stages, the body starts to shut down, and sometimes there are complications. It can lead to death.
This is heavy stuff.
It is. But, even with all of that, there's still hope. There are treatments out there that can help manage the symptoms, make things a little easier for folks, and that's what we'll talk about next.
Well, let's definitely get to that. Let's talk about those treatments and that hope. So, we've talked about how Alzheimer's progresses. It can be a tough thing to hear about.
It is.
But you mentioned there are treatments out there, treatments that can help. Can we talk about that? Where's the hope in all of this?
Yeah, absolutely. So while right now there isn't a cure for Alzheimer's, the treatments we have, they focus on, well, two main things: managing the symptoms and then hopefully slowing down how fast the disease progresses.
So, it's about making things a bit easier along the way, maybe buying some time.
That's it. It's all about trying to help people keep their independence, keep living their lives as fully as possible for as long as possible.
Okay, so what do those treatments actually look like? What are we talking about here?
Well, medication's a big one. There are actually a couple different types of drugs that doctors often prescribe.
Okay, break it down for me.
Sure. So first, there are these things called cholinesterase inhibitors. Big word, I know. But they work by, well, they increase the levels of this neurotransmitter. It's called acetylcholine, and it's super important for memory and learning.
Acetylcholine, didn't we talk about that before? With the those plaques and tangles?
We did. You got it. See,
Yeah.
those plaques and tangles, they mess up communication in the brain. And acetylcholine, it's one of the messengers that gets disrupted.
Ah, right, right. Okay, so these cholinesterase inhibitors, they're like what, reinforcements? Like they come in and boost the communication system?
Yeah, that's a good way to think about it. They can be really helpful, especially in those earlier stages, the mild to moderate stages of Alzheimer's. Like imagine someone's having trouble remembering conversations or they can't follow a recipe anymore. These meds, they might be able to help them get some of that back.
So not a cure, but they can maybe slow things down.
Exactly. Yeah. They won't fix the damage that's already there, but they can help protect those brain cells and keep things working a bit longer. And then there's another type of drug called NMDA antagonists.
NMDA antagonists. Okay, that's a mouthful.
I know, right?
But they work differently.
They do, yeah. They work on a different neurotransmitter, one called glutamate, and that's also really important for learning and memory.
So it's like hitting the problem from different angles, different ways to support the brain.
You got it. A common one is called memantine, and a lot of times doctors will actually prescribe that along with a cholinesterase inhibitor, especially for the moderate to severe stages.
Double teaming the Alzheimer's, huh?
Something like that. But, medication is just one part of the whole treatment picture. There are other things that are super important too.
Yeah.
We can't forget about lifestyle changes.
Right. All that stuff we keep hearing about, like healthy aging and all that. Does that really matter for Alzheimer's?
Oh, it definitely matters. It's like a lot of the things that are good for your heart, turns out they're good for your brain too.
Makes sense. It's all connected, right?
Totally. So things like making sure you're eating a healthy diet, lots of fruits and veggies, good fats, all that. And exercise. Exercise is huge. It's not just about your body, it's about your brain too. It helps with blood flow, and it actually stimulates new brain cell growth.
Wow. Okay, that's good to know. What about just like keeping your brain active? I feel like I've heard that's important too.
You're right on the money. The
Right.
more you use it, the better it works. So things like reading, doing puzzles, learning new things, even just socializing and hanging out with people, it all helps
So use it or lose it applies to the brain too.
big time. And then beyond medication and lifestyle, there are also some supportive therapies that can be really, really helpful.
Like what
Right.
what kind of therapies are we talking about?
Well, there's cognitive training, for one. That's where you do specific exercises and activities that really target those important skills, like your memory, your attention span, problem solving.
So it's like brain boot camp?
Kind of, yeah. And then there's behavior therapy, which can be great for dealing with some of the, the behavioral and psychological stuff that can come with Alzheimer's,
Hmm.
like agitation, anxiety, depression. It helps people learn how to cope, how to stay calm.
Yeah, because those symptoms, those must be tough, not just for the person with Alzheimer's, but for their families too, right?
Absolutely. And that's where support groups come in. They're so valuable. It's a place for people to connect, share their experiences, realize they're not alone in this. And it's not just for the people with Alzheimer's, it's for the caregivers too.
So it really takes a village, huh?
It really does. It takes everyone working together, doctors, caregivers, families, the whole community. Everyone's got a role to play.
Okay, so we've talked about a lot, but I gotta ask, what about the future? What's happening in the research world? Any exciting breakthroughs coming down the pipeline?
There is so much research going on right now, so many brilliant minds working on this. And yeah, there are some really exciting things on the horizon.
Give me the scoop. Like, what are the most promising areas of research?
Well, one that's getting a lot of attention is immunotherapy.
Immunotherapy, isn't that like a cancer treatment?
It is. They use it for cancer too.
Hmm.
And the idea is basically to use the body's own immune system to fight the disease. So with Alzheimer's, scientists are looking at ways to use antibodies to target those amyloid plaques we were talking about and basically clear them out of the brain.
Whoa, so it's like training your body to attack the Alzheimer's?
You got it. Pretty cool.